Every second counts in an emergency. What if someone you love suddenly collapsed and stopped breathing? Would you know what to do? We're diving into one of the most critical life-saving techniques everyone should know, CPR, or cardiopulmonary resuscitation. CPR is a vital procedure that can mean the difference between life and death in a cardiac emergency. But it's not just about chest compressions and rescue breaths. There are important steps and precautions to follow to ensure you're providing the best possible care. So, let's break it down step by step and equip you with the knowledge you need to potentially save a life. Step 1. Assess the scene. Before you rush in to help, ensure the area is safe for both you and the victim. Look for any potential hazards or dangers. Step 2. Check for responsiveness. Gently tap the person and shout, "Are you okay?" If there's no response, they're not breathing or only gasping, it's time to act. Step 3. Call for help. Dial emergency services immediately or instruct someone nearby to do so. Time is of the essence in a cardiac arrest situation. Step 4. Open the airway. Tilt the head back gently and lift the chin to open the airway. This helps ensure that the person can receive adequate oxygen during rescue breaths. Step 5. Check for breathing. Look, listen, and feel for breathing. If the person isn't breathing normally, it's time to start CPR. Step 6. Perform chest compressions. Place the heel of one hand on the center of the person's chest, then interlock your fingers and position your body directly over theirs. Step 7. Give rescue breaths. Pinch the person's nose shut, create a seal over their mouth with yours, and give 2 rescue breaths, each lasting about 1 second. Step 8. Continue CPR. Alternate between 30 chest compressions and 2 rescue breaths at a rate of about 100 to 120 compressions per minute until help arrives or the person starts breathing on their own. Remember, performing CPR can be physically and emotionally demanding. Here are a few precautions to keep in mind. Precaution 1. Ensure your own safety first. Don't put yourself in harm's way when attempting to help someone else. Precaution 2. If the person is in water, move them to a dry area before starting CPR to ensure effective chest compressions. Precaution 3. Avoid interruptions in chest compressions whenever possible. Consistent compressions are crucial for maintaining blood flow. Precaution 4. If an automated external defibrillator, AED, is available, use it as soon as possible. Follow the instructions carefully. And there you have it, folks. CPR is a simple yet powerful skill that anyone can learn. By taking the time to familiarize yourself with the steps and precautions, you can be prepared to act confidently and decisively in an emergency situation. Don't forget to like, share, and subscribe for more life-saving tips and tricks. Until next time, stay safe and stay prepared.